Well, the French model of pharmacy is putting pharmacy at the front line of healthcare. So basically, what the French government is doing is they're looking to make sure that people use pharmacy at the first point of contact wherever they are. So we know there are more pharmacies in France, about 22,000 pharmacies for a 66 million population. That compares to 14,000 pharmacies in the UK for the same population. But what this gives the government is reassurance that wherever you are, rural or urban area, you will have access to a community pharmacy at the front door near where you live. And part of control of entry for pharmacies is to make sure that the pharmacies that open serve the local population where they're open. And that's something that the French government is keen to do. Now, what can we learn from this? Well, the French government is very brave in funding a model that sustained 22,000 pharmacies on the territory, and having the confirmation by the government that there is a funding model that will sustain the network of pharmacy at the moment will make sure that we don't disrupt that. Now, the French model is very good at introducing new services. They're starting on January 2020 a minor ailment service, which will be a consultation with a pharmacist, generally self-referred. There will be the supply of a product that will be given to the patient if required, or it could just be advice. But what that will do instantly is they expect that it will save millions of GP appointments from day one. The other thing that the French government is doing is they looked at the statistic and they looked at the way flu vaccination service, for example, commissioned in the UK, and they thought, well, actually, in the UK, they've increased the amount of patients that are vaccinated by offering the vaccinations to pharmacies, so we're going to do the same thing. But on top of that, they are now looking at other vaccination service as a flu vaccination being a success story. And yet again, we could probably copy that in this country by saying, well, we've done flu vaccination for several years now. Is it time to introduce other vaccination services that could benefit, access to services to patients?